Yeah. Hello, am I on?
Yeah, you are now.
There you go.
Okay, so we'll all rise for the pledge, please. I pledge allegiance to the
flag
of the United
of
States
the
of
United
America,
States of America,
to the republic
to the republic
for which it
for
stands,
which it stands,
one
one
nation,
nation,
under God,
under God,
indivisible,
indivisible,
with
with
liberty
liberty
and
and
justice
justice
for all.
for all.
Play ball.
Okay, thank you, everybody, and we're going to call this meeting to order. It's the Public Safety Emergency Services Committee, Thursday, May 21st, 2020, and I'll ask Carrie Ann for roll call, please.
Ganga,
Here.
Zero,
Here.
Fagion,
Here.
Sierra,
Here.
Sassy,
Here.
Lujan, Hines,
Here. Okay, and there are other legislators on the line as well, I know, and I'm going to try to look at my participation screen. It looks like we have
Lujan here.
Breccia, Leader Benelli, and I just heard that Kevin Darren Lujan just came on as well. I know Mr. Cheney's on the line too. Any other legislators I missed?
nope, you got them all.
All right, great.
Chairman,
Okay, yes,
could we wish John Bureau a happy birthday today?
yes, we did that before you came on the screen, but happy birthday to John Vero.
Yeah, Steve, everybody sang but you. Now it's your turn to sing.
Well, happy birthday, John. And first up on our
Thank
agenda,
you.
I need a motion for discussion. We're going to have a report from Dr. Gelman and Commissioner Casey with respect to the COVID-19 virus. Motion for discussion, please.
So
So
moved.
Ganga.
Okay, that's the Ganga.
Rob.
And,
Sassy.
all right, and Rob Sassy is my second. Okay, you want to go first, Dr. Gelman, please?
Hi, good afternoon, everyone. Thank you very much for allowing me to join you today. As of today, we have a total of 10,237 COVID-19 positive residents in Orange County with 428 fatalities, a total of 41,286 tested. Last tested as of yesterday, so for yesterday, 919 tested, with a percent test positive for that 919 of 24.3%. And as this is progressing, that test positive percentage thankfully keeps declining. But keep in mind, it's also a factor of proliferation of testing. So as testing becomes more available, the criteria for testing is a little more lax, not as stringent, and the percentage of COVID positive returns is declining as well, along with expanding services. You may have heard about the pediatric multi-system inflammatory syndrome. There are currently 157 cases in New York. 25 other states and 13 countries are also reporting this syndrome. Essentially what it is an overwhelming inflammatory response to the viral load for that pediatric patient. So essentially, it's a pediatric patient that contracts COVID-19, they test COVID-19 positive, and the sequelae of the disease is such that after a period of time, they develop this heightened response, inflammatory response to having that high viral load. In terms of the percentage of the population that this impacts, on the contrary to some out there, the total percent of every single person who has contracted COVID-19, the pediatric population, it actually is a very small percentage of the total COVID-19 positive population out there. And out of that small percentage that is the pediatric population, an even small percent of that total of pediatric population that contract COVID-19 go on to develop complications, and some of those complications include this pediatric multi-system inflammatory syndrome. We have had a number of persistent positive COVID-19 residents And this is a phenomenon that is reported globally as well. That means an individual that has tested COVID-19 positive gets over the initial symptomatology. So then after a period of time, they become asymptomatic. As they become asymptomatic, they continuously test positive. They do not test negative. And this goes on for a protracted period of time. However, the good news is, as of a few days ago, there has been preliminary data from South Korea and a number of other respectable evidence-based medical journals to show that there is actually no transmission during that later phase when they continuously test positive. In terms of reopening criteria, you may have visited that regional COVID-19 metric where regions currently stand on the New York State Department of the New York State.gov website, and we currently meet 5 out of 7 metrics, with one of the metrics not met being the 14-day decline in hospital deaths or fewer than 5 deaths per the 3-day average. But we are moving closer to meeting that metric. And the other secondary, it's sort of a semi-metric, is the contact tracers and expected contact tracers. I did want to give one bit of information, and after that I will take any questions that we have out there. So as far as data, our epidemiologist was able to stratify some of the data, and in terms of the confirmed COVID-19 cases by age group in Orange County as of May 12th. So it is limited because it's up to May 12th. So that's a total cohort of 9,278 COVID-19 positive Orange County residents. We were able to obtain granular data, and for age range 0 to 17, so birth to 17, we had 4% of that total 9,278. For age range 18 to 44 years old, it has been 44%. For age 45 to 64, it has been 35% of the total 9,278. Ages 65 to 74 has been 8%, and age 75 and over was 7%. So overall, as you can see for Orange County, now this is Orange County specific data as of May 12th, we have been overwhelmingly predominantly in the younger population, specifically highest 18 to 44 range, and then second highest 45 to 64. Now this is for COVID-19 positive residents. We have not stratified data of deaths just as yet, but that will be forthcoming. Thank you very much.
Gotta unmute, Kev.
Thank you. Good call. Doctor, do you know how many pediatric cases we have with respect to that inflammatory disease? Is that something you're tracking?
So for the pediatric multi-system inflammatory disease, we sent out a public health alert to all of our providers as of 2 weeks ago when this first emerged. And we're just gathering that data from that public health alert, because as soon as this was emerging and we started seeing the first cases arise in New York State, we sent out that alert to our providers to essentially be on the lookout or retrospectively analyze a lot of their case studies to see if they have come across this already. So they haven't reported out just as yet, but we are absolutely tracking that.
Okay. So as far as we know, there's none. Do you suspect that there's none, or you're just not hearing about it yet?
We just haven't heard about it yet.
Okay. And is that transmitted the same way through the droplets, we think, or is there science on that yet?
So the pediatric and multi-system inflammatory syndrome, it's essentially a syndrome that's a result of contracting COVID-19. So they would have had contracted it the same way through droplet that has been passed on from an individual that's either symptomatic or just COVID-19 positive. But the sequela is such that a small percentage of those that already contracted COVID-19 go on to develop this as a specific complication.
Okay. Thank you. Any legislators on the committee have questions for Dr. Gelman? Okay. Sounds like there's none. So Brendan, do you have anything you want to share with us?
Just a couple things on the PPE. We're in good shape with that. Thankfully, Orange County took an aggressive position on that. We started out with a stockpile. We were able to acquire a lot on our own. We have a strategic stockpile resupplied now, and we are pushing a lot of it out. As most of you know, you've got some of the cloth masks and other things. We have so we're in good shape with supplies. We're still helping the state because we have a distribution network in place for all the nursing homes and places that are of concern. So the state is using us as a pass-through because we already have relationships in place with these places. So we're still moving a lot of supplies through the building, and that seems to be doing okay. I mean, the building is performing as it was designed to perform. We are in the process of packaging up supplies for individual places in hot spots in Newburgh and Middletown. They're going to go out with bags of supplies. The health department and some emergency management people, law enforcement possibly, go out, hang those bags on doorknobs out there. Doc knows those addresses. You can see hot areas of certain municipalities. So we're going to hammer them hard. That's where a lot of our cases are coming from. And then on the tracer program, the state came out with the metric of 30 per 100,000 residents. So we said, all right, so it's 100 for us or 110, whatever. They changed that and made it 350 for Orange County. So it put us in a bad spot. I myself went through the course. I'm trained as one now. 911, we have 35 people in 911 take the course. They're trained. Municipalities are jumping on board. Warwick is committing people. It's a number we have to get to. We're trying to fight through these hoops. Steve is on the phone constantly. You know, Steve would like to open Saturday. I don't know what's going to happen with that, but we're trying to get into phase one so we can get moving along on everything.
So just as a testament to the PPE and how aggressively we have been pushing out PPE from the very beginning, in terms of risk factors, epidemiological risk factors, because we did dissect that data of the 9,278 total cases, and again, that's through May 12th. The highest risk was obviously direct contact with COVID-19. That was 29% of the total cases for 9,278 cases that we've had. But as far as healthcare workers, which typically would be the higher risk category, for us, for Orange County, healthcare workers only accounted for 4%. So that's a testament to the fact of having adequate PPE and proper training on the use of PPE.
Yeah, okay. Thank you. Any legislators have questions for Dr. Gelman or Commissioner Casey?
Lujan.
Mr. Chairman,
Go ahead, Kevin Darren Lujan, I heard you first. Kevin Darren, the floor is yours.
I said I yield to the majority leader.
oh, Mr. Lujan, thank you very much. That's okay with the chairman.
You're up, Katie.
Thank you so much. Dr. Gelman, I just have one quick question. In your report, you categorized by age categories the amount of cases. Were you surprised by how those numbers fell out?
Absolutely. The prevalence among the 18 to 44 and 45 to 64, that's an atypical range. Typically, it is the older cohort. So I guess in a way, it's a testament to protecting our older residents, but also nonetheless, that high rate of propagation amongst the 18 to 44-year-olds is really something to be addressed on the educational side.
And have you drawn any conclusions? Because I'm drawing a lot of conclusions in my mind, and you don't have to, but I mean, do you have any idea of why those numbers came out the way they did?
So clearly a diminished perception of risk. That's typically the case among that cohort. So we are concentrating on a lot of effort, as Commissioner Casey has mentioned, especially with education. The state is currently directing all local governments to focus efforts on low-income neighborhoods, especially with outreach, testing sites, and education. So we have translated a lot of the information that we're sending out there. We're combining that with masks, with PPE, and really trying to have that out there in the community to ensure that we have the education and the outreach necessary.
So we could also draw a positive conclusion, if I may, that the older population is actually adhering to the social distancing, even though our numbers were high as far as the nursing homes were concerned, correct?
Absolutely.
Yeah, I think you see that with the, first responders, very low percentage of positives. Medical workers, very low percentage. if you follow the guidelines and you socially distance and you wear a mask and you do what you're being told to do, you're in pretty good shape.
And as far as the nursing homes being positive, essentially comparatively with other with other counties within the state, we actually had a relatively low number. But because obviously of the susceptible and vulnerable populations there, the rate of propagation tends to be high.
Absolutely. Thank you very much, Doctor.
Thank
And
you.
Brendan, thank you.
All right, Legislator Lujan, you're up.
Thank you, Mr. Chairman. So it was actually a two-part question, one for Commissioner Gelman and one for Commissioner Casey. So I did see that there was a lot of information that's going on. That's really great. I'm so happy to see also that a lot of it's being translated. Here in the city of Newburgh, I've been working with a few groups to try to disseminate PPE. I'd be happy to help here in the city of Newburgh and the town of Newburgh a bit. If been making bags filled with information. I'd love to collaborate in any way. I'm sure our volunteers would love to help out as well to, in any way we can here in the area. We've hit a few senior homes, again, just leaving them in plastic bag, like clear plastic bags that they have that we've made. And it's been really, really positive. We've got a great success with people. Seniors really, really appreciate it. We, however, are running out on hand sanitizer. I have a lot of masks, but I don't have a lot of hand sanitizers. If that would be really helpful, and that's something the seniors were really, really excited to have. So that was actually kind of part of my two questions altogether. One of my two comments. One, a great job, and two, if there's any way we can help, I'd love to be able to do so here with the resources and material in English and Spanish and PPE and hand sanitizer if there is still some available that could be brought over here.
We will have community health outreach reach out to you also, just to make sure we're closing the gap.
That's wonderful, excellent. Like I said, I'd be happy to help in any way. Like I said, we have a good team of volunteers here that are doing great stuff, and that way there's not duplication of activities. When we're giving out food, we can be giving out masks as well. When we're doing certain things for seniors, through Office of the Aging, for example, I'm going to be helping with them as well. So anything that we could do together, we're free labor, so just let us know.
We greatly appreciate it.
Yeah, I think they're going to be over here tomorrow at some point, and you'll see that the bags we have here are traffic safety stop DWI bags. So that's what the stuff's coming in. So you'll see them all over down there.
Great. Well, excellent. Like I said, if there is a way to pick them up somewhere and drop them off, we'd be happy to do that. If you have a list of specific areas, you just give us the list. We'll go knock them out for you. That way you guys can focus on whatever else. We need you guys on the front lines as well. So that way it saves you guys time. Thank you. Thank you so much, everybody.
All right. Any other legislators with questions?
Vero has a comment.
Oh, sure, go ahead.
Casey, just want to say thank you very much for the sanitizer and the masks. They were very well received in my district. There's a number of people having trouble still getting them, surprisingly.
Yeah, and we're in a good spot right now with supplies, and it's really a testament to the county's willingness to spend money. I mean, we kind of knew that the state would help us a little bit, but not all the way. We knew we were going to have to get this done on our own, and we spent a lot of county taxpayer money on stuff to protect people. And between the PPE that we got, we were able to obtain 42 ventilators, and every single one of those was used. We saved lives, no doubt.
Excellent. Thank you.
Okay, any other legislators? All right, so hearing none, thank you very much, Dr. Gelman, for joining us. And we're going to move on to number 2. Commissioner Casey, you going to handle that, or is Craig around? Or
Yeah, I'll handle it.
okay. All right, so item number 2, request to accept and appropriate 2020 Bureau of Justice Assistant Grant Coronavirus Emergency Supplemental Funding, local solicitation for the purchase and distribution of personal protective equipment to first responders and correctional agencies in Orange County. $58,008. Does everybody want to be on this?
Yes, sir.
Yes.
All right, so we'll put everybody on this. Carrie Ann, and go ahead, Commissioner.
It was just a grant opportunity that popped up from the Justice Department in the middle of this to purchase PPE and some sanitizing stuff. So Craig is on top of that stuff. He jumped right on it. So we will take that money and we plan on buying PPE, additional supplies. I think we're going to get 1 or 2 of our own sanitizers, the fogging sanitizers and the supplies that go in that. So we can do police cars or fire trucks, things along those lines if we have to. So it was free money that popped up and Craig jumped on it.
That's fantastic. How soon do we expect to receive that?
I don't, you got to approve it, we got to get the money, then we got to order it. So hopefully before wave 2, right, Doc? Doc is a wave 2, wave 3, wave 4.
Wave 2 with the flu.
Yeah.
So
I'm with her on that.
Okay. All right. Any questions about this?
Mr. Chairman, Lujan,
Sure.
is this grant something that local municipalities could also apply for, or is this mostly for county governments?
my understanding was it came out to the county. Craig did the one application for it. But any and all equipment we've gotten here has gone out to first responders, police, fire, EMS. So we don't just use it for county purposes. It goes into the stockpile. We assess requests from nursing homes, daycare centers. We've had everybody here, undertaker, mortuary services, schools. So we look at their needs. That stuff's all thrown in a pile, and then we decide how, who needs it the most, and we get it out.
Excellent. Thank you, Commissioner.
Okay. Any other legislators have any questions or comments?
No.
Okay, so we'll do a voice vote on this. All in favor?
Aye.
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 Anybody opposed? So carried, unanimous. Thank you very much. And Brendan, and you and the doctor can get back to work on the other side of the room, I guess.
Yeah.
Thank you very much.
Thank you
Keep
very
up
much.
the good work.
Hey, everybody.
And now we're going to move on to agenda item number 3 with the sheriff's office. And I need a motion to discuss the corrections report, please.
Move.
So moved.
Yeah.
Okay, I got Stiganga and
Sierra.
Benelli, I believe I heard.
Sierra.
Oh, Sierra. Stiganga and Sierra will be the movers of the corrections report. Is Colonel with us, Sheriff?
I am here. Hello. Can you hear me?
I'm having trouble hearing you.
I am here. Hello.
Okay,
All right.
we hear you now.
this
You want to
mor-
highlight the corrections report for us, please, Colonel?
Sure. Facility head count of this morning is 367. Of the 367, 91 is ICE, 84 is Marshall. Our total revenue to date is $3,548,581.
Anything else?
That's it.
Okay, so the revenue's on target to be above budget, so thank you for that. How about the conditions at the jail? Are we still COVID-free? Are we having issues? What's going on with that?
Yes, sir. We are COVID free.
All right, we're gonna knock on wood for that one. And that's a testament to the good work of not only you and the entire command staff at the sheriff's office, but everybody that reports to you as well. And we thank you for that. I think you're probably one of the few facilities in New York that are COVID-free, at least in this portion of the state of New York, especially counting in the New York City. So that is.
Kevin, can I jump in here?
Sure, go ahead, Sheriff.
Yeah, just so you know, it was late last week. I sent an email out where we had one inmate and one deputy was under that had been tested, but as of the first of this week, we have zero. We've maintained 0 inmates, obviously, since March 7th, and now we have 0 employees out of the 400 employees that we have. There's 0. Everybody's back to work, and we have nobody under testing, so we're in good shape. And as far as corrections goes, we've been discussing now for a couple of weeks about starting to up our numbers in the ICE and Marshal service. I think the Marshals probably will be more of a delay, but Tony's been in touch with ICE, and we're going to try to start upping our numbers, because obviously we know how the budget's going to be this year, and we want to start upping our numbers there. Obviously, with the many precautions that we've already taken, to keep the place COVID free. But there'll be quarantines, there'll be testing now that the testing is ramped up. So, but we are going to start looking into upping our numbers as far as ICE and Marshal Service.
Okay, thank you very much. Any legislators have any questions for the sheriff or the colonel with respect to the corrections report? I know from reading the corrections report that the only way to see a dentist is if you're in a jail, I guess, because there's dental reports there and nobody else can see a dentist in this county.
One of the safest places to be right now.
Anybody have any questions for the sheriff or the colonel? Okay, so hearing none, then I need a motion to discuss the sheriff's report, please.
So moved, Stiganga.
All right, I got Saganga. Is there a second? All right, I'll second it then. Everybody else must be on mute. Sheriff, anything you want to highlight? You are the under sheriff with respect to the sheriff's report.
Yeah, the under sheriff is going to take this.
Yeah, if you reviewed the report, you saw activity is down, mainly due to all the restrictions that are in society in general and our civil section, et cetera. We are operating within the pause task force. That's not in that report because there was no pause task force prior to this event. There's over 300 complaints that have come in on that. They are a broad range of validity to them. Most are not all that valid and consist of neighbors complaining about it, other people, et cetera. And some are valid that we address. Aside from that, we're going to have start to process pistol permits again next week for appointments because they come in one person at a time. So we can do that. And the same with safety classes. We'll kick off this weekend with a limited number of people in each class that are distanced, have their own, their own sim gun, et cetera. So we redesigned completely the way that we offer those classes. The last thing I have is we've started antibody testing within our membership to see how many people might have experienced COVID without suffering any symptoms.
Yeah, Middletown Medical is going to do that.
All right, that sounds great. With respect to that task force, you're working with the district attorney and the state police and the local police on that? And have there been any violations that are actually issued? Or is it just you tell people to disperse and they comply?
It's educational in nature because if you've been paying attention across the country, those that have sought to closely enforce things have run into a number of legal issues right away. There is much discussion as to whether executive orders of a governor done without legislative input constitutes validity in terms of criminal enforcement. And so in New York, throughout New York, even in the cases down in New York City, they immediately hit significant legal barriers, and most of the NYPD has now stood down on issuing summonses and things of that nature due to the fact that there's serious difficulties in trying to prosecute these types of cases.
Yeah, we're working with the state police. They receive the complaints and they triage them from there. And some they handle, some we handle, and some we farm out to the local PD. So we are, and Department of Health. So we are sharing the workload, and it seems to be going fine. You're on mute, Kevin.
Are you handing out masks to people if you come upon them in these type of situations? Does that task force do that if they come to a group where, say, there's a certain number of people, you don't have masks to hand out, do you?
I don't think.
Not that I'm aware of.
I don't think we want to start a process where we start publicly distributing masks as a law enforcement.
No, I just mean if you come upon an incident where people are not complying, say, here, take this and head on your way. Okay. Just a thought.
Hey, speaking of masks, we get a lot of traffic from the National Sheriff's Association. A lot of these vendors out there, not necessarily vendors that we use, are donating masks to sheriff's offices, and so we've been taking advantage of that, and we've been able to bolster our PPE. From what the county gets with the donations from all these vendors out there throughout the country. So it's working very good, and we're kind of holding our own with the amount of PPE that we have.
All right, that's great. Anybody have any questions on the sheriff's report for the sheriff or the undersheriff? Any committee members?
Nope. Lujan, Mr. Chairman.
Go ahead, Legislator Lujan.
Thank you, Mr. Chairman. First, I just want to thank the sheriff's department and everybody for everything that they're doing. Honestly, this is, here in the city of Newburgh, with everything that's happening, their office has been, phenomenal. I mean, the collaboration that we're seeing has been really, really great. And despite what we're seeing, with some of our leaders here in government, for the most part, I think that we're all in agreement that this collaboration is really, really necessary, considering how much gunshots and so on we're having here in the city of Newburgh. There was one point that has been mentioned by some, not only a council member that I'm not going to get into, but also some community members. And I think it is still important to ask the question. Although I personally have always seen sheriff and law enforcement wearing masks themselves, it has been mentioned by some members in the community if that is common protocol, that all law enforcement be wearing masks right now. As far as I can tell, it has been, but because this has been raised multiple times, I just wanted to kind of ease people's concerns about it, because from what I've seen, you guys have been amazing. Everything that, arriving in a timely manner, supporting our law enforcement in this really difficult time. I mean, you guys have gone above and beyond, so I don't want anything to taint the work that you're doing. And I say this with all full honesty. We are really happy to see the collaboration and the strong work that you're all doing. So I don't want anything to taint it. So I just want to make sure that that's something that we're making sure our law enforcement are wearing masks, that when they're arresting people, stopping someone, that they're wearing masks, because we don't want to have anything that's going to blow back on our officers. And again, we really thank your office for everything that you're doing.
Yeah, we do. Whenever we're in close proximity with anybody else, even on our own office, okay, whether it be inside the building or outside the building, our procedure is to mask up and take all the precautions you can. And just on a side note, we did have a great meeting on Tuesday with Acting Chief Kevin Lahar and a couple of other lieutenants, to discuss some strategy and just discuss some communication issues with the stuff that's going on over in the city of Newburgh. So again, it's we're doing what we can to help over there.
And again, I want to thank you for everything that your office is doing, and we're very confident in Acting Chief Lahar's his ability to lead the force. And again, this partnership only makes us more confident on the future. So just wanted to thank you. And again, it was more than anything just kind of ease those concerns from community members, which I myself personally have seen has been doing very, very well. So thank you again, Sheriff.
Yeah, KT, you have anything on that or no?
Yeah, I just want to add one point is so we're clear about the masks. There's some video crusaders out there that are trying to capture people without masks, and should be clear, especially when you're outside. If you're outside a 6-foot radius from someone, a mask is not mandatory. If you're driving a car by yourself, a mask is not mandatory. Prolonged breathing of your own flora and CO2 is not a healthy thing to do. We have full data as to when we should wear a mask. Within 6 feet of someone, either in a building or outside, you should be masked up. But there's no requirement to wear a mask all day long,
right?
Nor is it healthy.
Right, that makes sense.
I think the specific comment that was made was more when arrests were occurring. The allegation that was being made, and again, I as far as I can see, it's unfounded. Was that when there were arrests happening, that unfortunately law enforcement might not have a mask when they're arresting an individual. And again, this is unfounded as far as I can see, but it has been said by multiple community members. And so I just and from what I could tell, everyone is wearing a mask. So I just want to make sure that, like, if when I get a question from our community members, I can go back and tell them exactly what I'm seeing is what is the protocol when there is an arrest happening.
Mm-hmm.
Because I just want to just have your back on this situation, because again, I see the work that you're all doing.
I think our people prefer to wear masks when they're arresting people, no matter where they are. So understand that the mask, when you wear a mask, especially anything but an N95, purpose is to keep you from giving it to somebody else. It actually doesn't protect you. And
Right. Okay. Anybody else have questions for the sheriff or the undersheriff? Legislators not on the committee? Any questions? All right. Hearing none. Thank you very much. Keep up the good work and stay safe.
Okay.
Next, we'll move on to number 4, and I need a motion on this. It's going to be a resolution of the Orange County Legislature in support of New York State Senate Bill 5459 and Assembly Bill 6215, seeking to amend New York State Vehicle and Traffic Law, Section 1203, in relation to accessible parking space requirements for persons with disabilities and enforcement of illegal parking. Legislator Kulisek brought this to my attention, asked me to put it on the agenda. I told him I'd be happy to do it. It passed unanimously yesterday in the Rules Committee. Basically, this deals with handicap parking and people parking too close to the cars. In other words, there's the blue lines next to it, and some people have vans with wheelchair accessibility where the ramp has to come down, and if people park too close to them, the ramp can't come down. And on private parking lots, the allegation is that the law enforcement doesn't have the ability to tow or to ticket because they don't have jurisdiction unless the private landowner asks the police to be involved, I guess. So this is going to make it automatic, and that's the reason I think everybody supported it. Legislative Counsel Reed, do you have anything else to add to that?
I do not, sir.
All right.
Lujan motion.
Okay.
And
Yeah,
I'll
you're
second
right.
it.
Okay, so does everybody want to be on this? We'll have Lujan and Stiganga. Does everybody want to be on that?
Yeah. Yes.
Okay.
Yes.
So Carrie Ann, we'll put everybody on that since there was no objection. I just kind of highlighted it before the motion. If anybody has any questions for either Legislative Counsel Reed, I only know what I got from Mr. Kulisek and read up on it. I'm sure the sheriff could probably handle questions with respect to that as well. So any questions on this? I know a lot of you heard it yesterday. Okay, so hearing no questions, we'll do a voice vote. All in favor?
Aye.
Opposed? Okay, hearing none, that carries unanimously. And we have nothing else on the agenda, so a motion to adjourn is in order. Before I do that though, I want to make sure everybody has a very reflective Memorial Day. I was taught that by General Hussey from Cornwall. He always says there's no such thing as a happy Memorial Day. He always says have a reflective Memorial Day, and think about our soldiers who have given their life so that we could live here in a free society and have meetings like this. So thank you all for participating, and this will conclude the meeting. A motion to adjourn, please.
So moved.
Thank you. Bye now.